Overwhelmed by fear, understanding panic disorder. Do you ever find yourself gripped by sudden bouts of anxiety and intense fear, lasting several minutes? Your heart may race, sweat beads on your skin, and clarity of thought seems beyond reach. These episodes strike unpredictably, devoid of any apparent trigger, leaving you in constant dread of their return. Left untreated, panic disorder can disrupt your life, impairing performance at work or school. The silver lining: panic disorder is manageable. Discover more about its symptoms and how to seek assistance. What is panic disorder? Panic disorder entails frequent, unforeseen panic attacks. These episodes entail a sudden surge of fear or discomfort, accompanied by a sensation of losing control, even in the absence of discernible danger. Notably, not everyone experiencing a panic attack develops panic disorder. Physical symptoms akin to a heart attack, trembling, tingling, rapid heartbeat are common during panic attacks. They can strike at any moment, instilling a persistent fear of recurrence, prompting significant lifestyle alterations to evade future episodes. Frequency ranges from several times daily to a few times yearly. Typically emerging in late adolescence or early adulthood, panic disorder disproportionately affects women. Signs and symptoms of panic disorder. As manifestations of panic disorder may include repeated, sudden panic attacks infused with overwhelming anxiety and fear, a sensation of losing control or impending doom during an attack, persistent apprehension regarding the next panic episode, avoidance of locations linked to past panic attacks, physical symptoms during attacks, such as racing heart, profuse sweating, chills, tremors, weakness or dizziness, numb or tingling extremities, chest or stomach discomfort. Understanding the causes. While panic disorder exhibits familial tendencies, its exact cause remains elusive. Researchers speculate that certain brain regions and biological processes underpin fear and anxiety. Some posit panic attacks as false alarms, wherein our innate survival mechanisms overreact, triggering sensations akin to emergencies like heart attacks. This cycle perpetuates, culminating in recurrent, unprovoked panic attacks, the hallmark of panic disorder. Ongoing studies delve into the intricate interplay between the brain and body in individuals with panic disorder, aiming to develop tailored treatments. Moreover, researchers investigate the impact of stress and environmental factors on the disorder's onset and progression. Treating panic disorder, finding relief from overwhelming fear. If you're grappling with symptoms of panic disorder, reaching out to a healthcare provider is paramount. Following a comprehensive discussion about your medical history, a physical examination may be conducted to rule out any unrelated physical conditions. Treating panic disorder, finding relief from overwhelming fear. If you're grappling with symptoms of panic disorder, reaching out to a healthcare provider is paramount. Following a comprehensive discussion about your medical history, a physical examination may be conducted to rule out any unrelated physical conditions. Subsequently, you might be referred to a mental health professional, be it a psychiatrist, psychologist, or clinical social worker. The first step toward effective management is obtaining a diagnosis, typically from a mental health specialist. Panic disorder is commonly addressed through psychotherapy, also known as talk therapy, medication, or a combination of both. Engage in a dialogue with your healthcare provider to determine the optimal treatment plan for your needs. Psychotherapy. Cognitive behavioral therapy (CBT), a well-established form of psychotherapy, is frequently employed in treating panic disorder. CBT equips you with alternative cognitive patterns, behaviors, and responses to the sensations accompanying panic attacks. By altering your reactions to anxiety and fear during an attack, the frequency of such episodes can diminish. Exposure therapy, a key component of CBT, revolves around confronting the fears and beliefs associated with panic disorder. This approach encourages individuals to engage in activities they've been avoiding, often supplemented with relaxation techniques. For further insights into psychotherapy, consider exploring the National Institute of Mental Health (NIMS) Psychotherapy's webpage. Healthcare providers may prescribe medication to alleviate symptoms of panic disorder. Several classes of medication have proven effective, including Antidepressants such as selective serotonin reuptake inhibitors, SRAs, and serotonin norepinephrine reuptake inhibitors. Anti-anxiety medications like benzodiazepines. While SSRIs and SNRIs are commonly utilized for depression, they've demonstrated efficacy in managing panic disorder symptoms. However, these medications may take several weeks to manifest their effects and could induce mild side effects such as headaches, nausea, or sleep disturbances. Typically, these side effects are manageable, especially if the dosage is gradually increased over time. Beta blockers can help mitigate physical symptoms like rapid heart rate and sweating associated with panic disorder, albeit they're not commonly prescribed for this purpose. Benzodiazepines, potent anti-anxiety sedatives, offer rapid relief from panic attack symptoms but carry the risk of tolerance and dependency. Consequently, healthcare providers may limit their use to short-term scenarios. Both psychotherapy and medication may necessitate time to yield results. It's not uncommon for individuals to experiment with multiple medications before finding the most suitable option. Collaborate with your healthcare provider to determine the optimal medication, dosage, and treatment duration. Embracing a healthy lifestyle, comprising sufficient sleep, regular exercise, a balanced diet, and seeking support from trusted family and friends can complement the management of panic disorder. Explore additional strategies for maintaining mental well-being on NIMS Caring for Your Mental Health webpage. Self-support and assistance for others. Empower yourself or a loved one grappling with panic disorder by arming yourself with knowledge. Familiarize yourself with warning signs, treatment modalities, and ongoing research endeavors. Open lines of communication serve as a vital conduit for support. If you're experiencing symptoms, confide in a trusted individual about your struggles. Likewise, if you suspect a friend or family member is contending with panic disorder, express your concern and offer unwavering support through heartfelt conversations. Recognizing when to seek professional help. Persistent anxiety that encroaches upon daily functioning warrants professional intervention. Whether it disrupts academic pursuits, professional obligations, or interpersonal relationships, it's imperative to consult a healthcare provider regarding your mental health, clinical trials, and seeking help. NIMS spearheads various research initiatives, including clinical trials aimed at elucidating novel prevention, detection, and treatment avenues for panic disorder. While participation in clinical trials may offer benefits, it's essential to comprehend that their primary objective is to advance scientific understanding for the betterment of future interventions. Engage in a dialogue with a healthcare provider to explore the possibility of clinical trial involvement, weighing its potential benefits against associated risks. Delve deeper into available resources via NIMS Clinical Trials webpage. Behavioral Health Treatment Services Locator. Facilitated by the Substance Abuse and Mental Health Services Administration (SAMHSA), this online tool aids in pinpointing mental health treatment facilities and programs. Discover facilities within your state by perusing SAMHSA's Behavioral Health Treatment Services Locator.